How have you been?
Great. What about you?
So, doing awesome. Our Mastering Chronic Pain book is doing amazing. We love educating and teaching everybody about just new tools and tricks that you can use in your healing from chronic pain. Our goal is to always get you as functional as quickly as possible. So, Matt, have you heard about low dose naltrexone? Actually, a lot of people have not heard about of this amazing tool.
Yeah, it's really an interesting tool, medicine, drug. It's the same medicine that we use at high doses to reverse opioid overdoses, but at low doses it works completely differently.
Yeah, and I think that's a really important concept to explain. So, why don't you explain to our audience how can one medicine at different doses have totally different therapeutic effects?
So at high doses, the naltrexone binds to the opioid receptor. So have you heard people who have an opioid overdose? This medication will bind to those opioid receptors and block them, and it kind of brings them back to life, right? So it's how you bring someone back from an opioid overdose. But at a fraction of the dose and taken orally, it works totally differently. And what it seems to do is it seems to downregulate the inflammatory cells that live around the nerves, these things called glial cells. And when the glial cells become overactive, they dump all these inflammatory chemicals onto the nerves, and that can really amplify pain, make it much more intense. And
Yeah.
so when you take this low dose of naltrexone, it seems to temporarily block those receptors and really can change the system.
I think that's a huge distinguishing feature. And I think it's an important concept because obviously, as a pharmacist, we learn a lot about pharmacology. And it's really the different doses and types and how they bind or unbind to the receptor. It's kind of like the key and lock concept. Drugs can have different effects, as in this case. And I think the biggest misnomer about low dose naltrexone that it's really not a blocker for the opioid receptor at the low doses. At the high doses it does, but at the low dose it's really more of an immune modulator. And really, we have over probably now 400 studies on the use of low dose naltrexone in a variety of disorders, but anything that is inflammatology, as I call it. And I think really, probably even to this day, it's the best tool that we have for what we call neuroinflammation, for things that kind of get your brain on fire. And that's what sometimes chronic pain becomes, what we call chronified or centralized pain syndromes. It's just like your brain is on fire. And this is really one of the greatest underutilized tools to kind of douse that inferno in the brain and really lock it. And I think it's important to know that it's an immune modulator, not an immune stimulant, because I know sometimes we really don't distinguish that difference and we worry about using it maybe in autoimmune syndromes and things like that. But there's a lot of studies actually about the use of dousing, anything inflammation, whether it's the origin autoimmune or chronic pain, when the nerves are overactivated like they are a lot in chronic pain. I think it's really important to understand how it modulates these immune systems, calms down the fires, and calms down chronic pain in this setting. So I think that's really important distinguisher.
Yeah, in fact, we use it quite frequently in autoimmune conditions. It really seems to shine there. People who've got an autoimmune type of pain syndrome, this low dose naltrexone frequently will help people in that condition. Fibromyalgia, closely tied, but it seems to work really well for those people as well.
Yes, especially for whole body syndromes, as we call it, which absolutely CRPS, there's a lot of great data on it now. So I think definitely we urge patients and clinicians to really continue to learn about this amazing tool. So, Matt, currently low dose naltrexone, is it really a standard pain medication? Do you see it utilized a lot in the clinic, or is it just in certain clinics where, clinicians have been educated about this amazing tool?
I would say it's not used frequently. I mean, we use it quite a bit, but it's what you'd consider off-label, right? This is not what the intent for the drug is, and it's not even available commercially in this kind of a dose. It has to be compounded or created by a pharmacist from a powder and put into a pill or a tablet form, or even mixed into a powder form to drink. So it's what we would consider off-label. It's not considered standard of care, but there's certainly quite a few studies that show that it could be very helpful in certain conditions, especially when nothing else is seeming to work.
So, LDN is not a cure for everybody, but it's definitely one additional amazing tools that I know we have been using for years and years with some incredible results in some patients. Definitely this is personalized. Sometimes the doses that each person require because it's modulating that system are very different, but it's definitely one of the newest tools that we're researching. It's being studied tons in a lot of different conditions to really calm this overactive pain system and this overactive immune system in certain settings.
Yeah, exactly. And if you've heard about it, you're curious, talk to your clinician, see what they think. I mean, we cover some of these emerging options like this in our book, Mastering Chronic Pain. So check it out.